Good afternoon. This is my IV medication administration critique. My badge. I'm going to go right into an environmental scan. What I have on my table is my policy and monograph, client chart, worksheet, drug class, and blank paper for my map. So I'm going to go right into my drug classification. The drug we're giving is ceftriaxone. Its class is cephalosporin, generic name ceftriaxone. It's an antibiotic and it stops the growth of bacteria. Side effects or adverse reactions include nausea, vomiting, allergic reaction, confusion, diarrhea, drowsiness, fainting, fever, headache, hives, and low blood pressure. Its onset is rapid. Peak is 5 minutes. Duration is from 6 to 12 hours. Some nursing implications would be to assess for previous sensitivity, change site every 72 hours, assess for infiltration or full bodies at the IV site. Patient teaching would be to report any signs of superinfection. If rash appears, notify the health professional. And if you're experiencing diarrhea, do not treat without notifying. So I'm going to go right into my policies. And before I give this medication, I want to ensure that I have the knowledge, skill, and judgment to proceed with this administration. And I also want to check the compatibility of all IV medications with other medications and fluids running through the line. It must be assessed and confirmed prior to commencing administration. I'm going to open my client's chart just to collect some relevant information. So we have Sid Garland. He is a 54-year-old male being admitted to the hospital for a below-the-knee amputation of his left leg. The patient has suffered from a gangrenous foot ulcer for the past year prior to amputation. Mr. Garland is 5 days post-operative. He tolerated surgery well, but is experiencing complications due to infection. Mr. Garland's diabetes is unstable and wound healing is impaired. Past medical history includes type 2 diabetes, myocardial infarction, 2 years ago, peripheral neuropathy, coronary artery disease, asthma. Mr. Garland lives with his wife. Okay, and AIDS. Okay. Patient is 5 days post-op, complaining of pain at the left leg, site of amputation. He's reporting a 7 out of 10 on the pain scale. Dressings were removed to assess the wounds. Appears red and approximately 2 inches. Appears red approximately 2 inches around the surgical site with purulent drainage. The patient is awake. He is full code. His vital signs are within the normal range, except his heart rate is a little elevated. It's at 110. Should be between 60 to 100. Surgical team removed left leg dressing to assess surgical site. Bandages changed with large amount of serous sanguinis and purulent drainage. Still in a 7 on the pain scale. Subcutaneous analgesics, pain as ordered. So while looking at patient's lab values, his white blood cell count is very high, 25.7, when it should be in the range of 4.0 to 11.0. It's very high. So at this point, I'm going to go into my signature sheet and sign off. So it's the 7th of August, 2020. My name printed. My status is an RPN student. My signature and values. And I'm going to verify my doctor's orders with my mark. Okay, this is for Sid Garland. Sid Garland. MRN number is 344316, 344316. Date of birth is 11/08/1965, 11/08/1965. Doctor's name is on the MAR and the order. Patient is allergic to penicillin and codeine. Penicillin and codeine. Drug we're giving is ceftriaxone. Ceftriaxone, 500 milligrams 500 milligrams. Route is IV. IV frequency is every 12 hours, and this will be given in the site of his hand. Special directions is that this is given for seven days, and the 3 times to be given is 0600, 1400, and 2200. The 600 has been given, so we'll be giving the 1400 hour administration today. So I also want to state what is currently running. So he is on IV or normal saline at 125 milliliters an hour. So I'm going to refer to my monograph, and I want to just know the diluent and the time to infuse over. So the diluent is between 50 and 100 milliliters of IV solution, and to infuse over 10 to 60 minutes. Using clinical judgment, I'm going to choose to run this bag over 20 minutes today. And I also want to do any pre-assessments. So he is allergic to penicillin, so there is a hypersensitivity to that. Current drugs that he's on are not contraindicative to the medication will be given. So I also want to refer to my my monograph about Y-site med-to-med compatibility. He's currently not on any med for his IV, so that's compatible. The solution in the mini bag is normal saline, and ceftriaxone is compatible with that. And also what's running in the main bag is normal saline, so again, that is compatible. Okay. So I'm going to want to go into my patient's room. I'm going to introduce myself as Caitlin Jarvis, and I'm a nursing student from Durham College. I want to just go in and assess that it is the normal saline that's running. I want to check the expiry date, December 2000. Perfect. I want to ensure that it is labeled. So this was put in today at 0600. There's no kinks in the line. And I also want to assess the site for any infiltration or phlebitis or just any adverse reactions to the medication. This is also dated for today. This was put in this morning. Okay, so I am going to go over and I'm going to grab my medication. And I'm going to grab my second line. I'm going to inspect this bag for color, clarity. I want to check for any leaks. I also want to check the expiry date on both the bag and the order. January 2021, perfect. August 2028, perfect. I'm going to go right into my first check, comparing my med to my MAR. So this is for Sid Garland. Sid Garland, drug is ceftriaxone. Dose is 500 milligrams. 500 milligrams. Route is IV. The site will be in his hand. Site is in his hand. Frequency is every 8 hours. Time we're giving it is the 1400 because it's not been given yet, and the reason is because he's experiencing infection due to his recent leg amputation. Go right into my second check. So this is for Sid Garland. Drug is ceftriaxone. Dose is 500 milligrams. Route is IV. Site will be in his hand. Frequency is every 8 hours. The time to be given is 1400 hours, and that has not been given yet, so that's the time will be given. And the reason is for a complications of infection due to his recent leg amputation. So right now I'm going to, go into my math. So I want to figure out two separate calculations, the infusion rate and the drops per minute. So for drops per minute, first of all, this is blank. I just put that there now. Drops per minute is volume over time times 10 milliliters. So my volume is going to be 50 milliliters. My time is 20 minutes times 10 milliliters. So 50 divided by 20 times 10, 25 drops per minute. So my infusion time is volume over time times 60 minutes per hour. So my volume again is 50 milliliters. My time is 20 minutes times 60 minutes per hour. So where I'm getting the 10 and 60, the 60 minutes in an hour, and the 10 is on the bag. 10 milliliters is on the IV bag. So 50 divided by 20 times 60 equals 150 drop per hour. Okay, I'm going to go right into my third check. So it's for Sid Garland. The medication is ceflazoin. 500 milligrams, and we will be regulating our drops per minute for 25 drops per minute. So yeah, 500 milligrams. The route is IV. Site is in his hand. Frequency is every 8 hours. And the times to be given is 0600, but that has already been given, so we'll be giving the 1400 hour dose. And the reason is for complications due to infection from his amputation. So I'm just going to plug my computer in. Plugging in. Okay. So now I'm going to flip over my sheet and redo my calculations. Drops per minute is volume over time times 10 milliliters. Volume is 50 milliliters. Time is 20 minutes times 10 milliliters. 50 divided by 20 times 10 equals 25 milliliters, 25, drops per minute. My infusion is volume divided by time times 60 minutes per hour. My volume is 50 milliliters times 20 minutes times 60 minutes per hour. 50 divided by 20 times 60 equals 150. 150 minutes. Okay. So at this point, I am going to get my teacher to come in and do an independent double check of my IV mini bag, my medication, and my MAR. So at this point, I'm going to do some hand hygiene with my secondary line and my medication. Sorry, I had said the 10 milliliters was on the IV bag. No, it's on the secondary line. So opening this. Hook, secondary line. I'm going to remove the tape here. I'm going to close the roller clamp right away. So maintaining sterile sepsis. Going to undo that. I'm going to spike my bag. Okay. So again, going into my patient's room, I've already introduced myself, but I'm going to now explain the procedure that I'll be hanging a secondary line. So I also want to do an environmental scan at this point, making sure everything is in working order, O2 and suction. I want to make sure the bed is locked, rails are down, free of clutter. So when I go into the room, I'm going to go in with my patient's chart, and I'm going to check his wristband and just making sure that I have the right patient. So checking the wristband. This is for Sid Garland. Sid Garland. Birthday is 11/08/1965. 11/08/1965. And patient ID is 344316. 344316. And I want to ask him if there's any allergies that I should know about. And he states that he's allergic to codeine and penicillin. And I also want to ask what type of reaction happens when you are introduced with these medications. Okay. So now I'm going to hook up my line. So do this. I'm going to right away stop the main line. Okay. I'm going to swab the port vigorously. My alcohol swab, trying to maintain sterile sepsis. So I'm going to open my mini bag, and I'm going to attach the piggyback. So at this point, I'm going to open my mini bag to prime my tubing and hang it lower. Okay, I'm going to stop that. And now I want to take my clamp hook, I'm sorry. I'm going to hook up my mini bag higher than my main bag. Okay. I'm going to open my mini bag. This was not overfilled, so I don't have to squeeze any excess out. See that? Okay. So now I'm going to open my main while I'm looking at this one. And I'm going to assess for it running at 25 drops per minute. Move this closer. I'm just going to start again because I realized it was going too fast. Okay, I did miscount, so I'm going to restart. Now. It was one drop short, so I'm going to start my minute over. Now. Okay, perfect. She's running at 25 drops per minute. So in about 15 to 20 minutes, I'm going to come back and I'm going to do a post-assessment, just checking for any allergic reactions or adverse reactions from the IV. I'm going to want to assess his vitals, and I'm also going to want to assess that IV site just to see how he's managing. So before I leave the patient's room, I'm going to do another environmental scan, just making sure the bed is in the lowest position, call bell is in reach, and I also want to give some patient teaching before I leave the room. I want to notify the patient if he is having any rash or problems with the skin. Just press that call bell and let us know immediately in hopes that he's not facing an allergic reaction. I also want to let the patient know if he's experiencing any diarrhea to call as well. Don't treat that on your own. And at this point, I also want to sign off for the time that this medication was given. So the date is the 7th. It's August 2020. I want my signature. And I'm also going to call the teacher over for a cosign. Okay, thank you very much.